Breastfeeding should be a comfortable and bonding experience for both mother and baby. Using the right position can make all the difference in reducing strain and improving milk flow. In this video, we'll explore the best Medela recommended breastfeeding positions for maximum comfort and effectiveness. Proper positioning is key to preventing nipple pain, ensuring efficient milk transfer and reducing fatigue. When a baby latches well and the mother is comfortable, breastfeeding becomes a smoother experience. One of the most traditional positions is the cradle hold, where the baby rests on the mother's arm, providing close support and easy access to the breast. The cross-cradle hold is ideal for newborns, allowing better head control and guidance for a deeper latch. The football hold is recommended for C-section moms, keeping pressure off the incision while providing excellent control. The side-lying position is great for nighttime feedings, allowing both mother and baby to relax while nursing. Lastly, the laid-back position uses gravity to support a baby-led latch, promoting comfort and natural feeding cues. To enhance comfort and milk flow, use pillows to support your back and arms, ensure a deep latch to prevent discomfort, and switch positions occasionally to relieve pressure points and prevent clogged ducts. Breastfeeding should be a pain-free and fulfilling experience. Try these positions and find what works best for you and your baby. If you found this guide helpful, like, subscribe, and share with other moms on their breastfeeding journey.